Let's talk about something many women living with diabetes experience, but we rarely say it out loud. Low libido, the loss of sexual desire, pain during intimacy, and feeling disconnected from your body. If you live with diabetes and you've ever wondered, is something actually wrong with me? Then this video is for you. You are not broken and you are definitely very okay. It's something that can be sorted. So now let's give libido a definition and why it matters. So libido is your sexual desire, but it's also deeply connected to your hormones, your blood glucose level, your emotional well-being, your body confidence, your relationship safety, and communication. For women, libido is very, very complex, and diabetes can actually affect every layer of it. I will like to talk about how diabetes affects libido in women now. So I have 6 points that I'm going to go through one after the other. And the first one is looking at blood sugar imbalances. So high or fluctuating blood sugar levels can actually cause a lot of fatigue, brain fog, reduced energy, reduced arousal. The point to note here is when your body is exhausted and you are just trying to function, intimacy is often the last thing that comes to mind. So it's something that can be helped when you've gone through all the high and fluctuating blood sugar levels, all the points I have just mentioned: fatigue, brain fog, reduced arousal, reduced energy levels, just makes you not even think about intimacy. It's just the way we function as women. So number two, we've got nerve damage, neuropathy. Most of us might think that neuropathy is just centered around your fingers, that's your upper extremities and your lower extremities, but diabetes can actually affect the nerve endings involved in giving you some form of sexual pleasure, and this can lead to you having reduced sensation, you have difficulty reaching an orgasm, pain and discomfort. So all these are medical and not psychological, and they are all treatable. The third is refined blood flow. So poor circulation can actually reduce that natural lubrication and arousal, thereby making intimacy very uncomfortable and painful. The point to note here is that pain during intimacy can quietly teach the body to avoid that desire altogether. That's just the way it happens. And the fourth is hormonal disruption. Diabetes, especially alongside conditions like PCOS or perimenopause, can actually affect your estrogen levels, your testosterone balance, your vaginal health. Another point to note is that hormones play a very, very huge role in desire, arousal, and pleasure. The fifth is recurrent infections. So when you've got frequent thrush or UTIs, this can lead to pain, fear of intimacy, and shame. And all that I have just mentioned can actually cause women to stop wanting intimacy because it just feels like it leads to discomfort and infection. So the sixth point is emotional and physiological factors. So we all know that living with diabetes can affect our body image, our self-esteem, and the fear of hypo during intimacy is something that, when I say all women live, especially if you live with type 1 diabetes and on insulin, that fear is always there that you might go into a hypo whilst you're intimate with your partner. And sometimes we kind of like feel medicalized instead of feeling feminine. Intimacy is mental as much as being physical. And by God, diabetes can be emotionally heavy, really, really, really weighty. Like, it comes with so much emotion that you can't even begin to describe. Now, let's look at why women living with diabetes don't talk about reduced libido. For your information, this is just my point of view. I stand to be corrected. Many women were never taught that sexual health is actually health, and desires fluctuate, and that is okay. It's a natural occurrence or natural feeling, and diabetes really affects intimacy. Cultural silence, stigma, shame make women suffer very quietly. We don't like to talk. We just like to just build up all the emotions inside and find it very difficult to express how we feel. But this silence, does it heal? It doesn't. Silence does not heal. When you talk, that is when you find healing. You get healing. You feel whole again. So no silence. Talk more. Let's get into that conversation. The next step is, how can we actually address this obviously very sensitive topic? So I'll say it again. From my point of view, I think we have to normalize this conversation. Low libido is not a personal failure. It is a common diabetes related issue among women living with diabetes, even men living with diabetes. We must say this out loud. We need to speak to our diabetes healthcare team, and we need to understand that diabetes care actually goes beyond HbA1c. We need to ask our healthcare team about having our hormonal tests done, checking our vaginal health, and doing a neuropathy check and mental well-being. And we also have to try as much as we can, to the best of our ability, to improve our glycemic stability. So better time in range can improve energy, mood improvement, better hormonal balance, sexual comfort. So having that glycemic stability, you can achieve all of this. It's not about perfection. It's actually about your patterns and seeing what causes the triggers to get you out of range. Once you've achieved glycemic stability, all that I have just mentioned will naturally come into play. So we also need to address vaginal and intimacy comfort. So speaking to your healthcare team, they might recommend lubricants or vaginal moisturizers. And when you feel that you have an infection, it's wise that you get it sorted out early, and also try to do or get your pelvic health support. Honestly, comfort is very, very, very important in our libido matters as women living with diabetes. And we should also try to prioritize mental and emotional health. When you get stressed up, you're burnt out, diabetes fatigue will just totally mother that desire to even want to be intimate. So involving yourself in some form of therapy, peer support, and having very honest conversations with your husband, your partner, can really be very transformational. Honestly, my husband has gone above and beyond in this regard. We need to redefine intimacy. Intimacy should not just be about penetration, it should be about touch, connection, safety, and feeling seen. Desire grows where pressure disappears. So we need to have this at the back of our mind. My take home message today is, if you live with diabetes and you're struggling with libido, hear this. You are not alone. You are not failing. Your body actually deserves some form of compassion, and your pleasure matters as a woman living with diabetes. Let's stop whispering about women's health. Let's vocalize. Let's talk. Let us heal together. I speak from a personal experience, and the tips I have just given out today in my video, or rather I have shared in this video, help me to heal. So feel free to use them. They're my point of view. It could help someone out there, and I hope you enjoyed this very sensitive and yet interesting topic that is not often spoken about. And I'll see you all in my next video. Don't forget to like, share, subscribe, and you hit that notification so you get notified when my videos come up. And I'll see you all in my next video. Thank you for watching. Bye.